Hi guys, welcome back to Biology with Nyosk. For those who are new in this channel, Nyosk is my name and you're very welcome. Feel at home. Subscribe if you've not subscribed. Since in this channel we learn biology with me, Nyosk. By the end of this episode, kindly make sure you subscribe if you've not subscribed, give me a like, share also, and help me reach to 1,000 subscribers. And be ready to learn and learn, because knowledge is power. Today we are going to discuss on the first aid measure that you're supposed to take when a person is nose bleeding. Okay, I thought of this because there was a time I had a cousin, a small cousin close to me, and she was nose bleeding. Funny of all, I was shocked enough to see that a girl of 5 years old and she was able to perform first aid for herself, and that made me proud of her. So for those who don't know how to perform a first aid to a person who is nose bleeding, today I'm going to walk with you through the steps that are required to take when a person is nose bleeding. Now, before we continue with the video, just give me a thumbs up because you're going to enjoy this episode. When a person is nose bleeding, you're supposed to be in a position of which you can tell if a person is nose bleeding seriously or not. If the nose bleeding prolonged for more than 30 minutes, that means that the person is nose bleeding a lot, and that may lead to shortage of blood, so rush this person to a hospital. And if the bleeding stops for 10 minutes or to 15 minutes, then you should know that this type of bleeding is not so serious and you can just wait. If the bleeding occurs again, then try to perform a first aid to this person. If it prolongs, just take this person to a hospital. Before we start performing our first aid, there are things that you're supposed to know. For a person to start nose bleeding, there has to be reasons or the causes of the person to nose bleed. And these are the reasons. First of all, maybe this person has some diseases that may cause a person to nose bleed. Diseases such as liver problems can cause a person to nose bleed. Other diseases are like blood disorders, diseases that are related to blood disorders. This can lead to a person to nose bleed. There are other reasons such as dryness, like when a room is so dry, there is no humidity in it, it can cause a person to nose bleed. Other causes are like those people who normally take alcohol. Alcohol may lead to dehydration since during the process of detoxification, and so this alcohol taking may lead to a person to nose bleed. Another cause of nose bleeding may be scratching yourself with maybe a pin or even your nail at your nose. That may lead to nose bleeding. Now these are the steps that you're supposed to take when a person starts nose bleeding. First of all, note the mistakes that people do. You may find a person is nose bleeding, and instead of them staying upright or sitting upright and slightly bending, you may find a person is like this. Okay, first of all, that patient should not stay like that. because when you stay upright so much and bend, you are squeezing your head at the back and you may swallow the blood. That may lead to digestive problems, causing stomachaches. Another thing is the person should not also bend so much to an extent of letting the head pass the heart limit. That person should not do that. Bend just a little. This is for the purpose of reducing the pressure that may come along at the veins of the nose. Something else is you can pinch your nose like this using your thumb finger and your first finger. Squeeze it for like 10 to 15 minutes, and since normally we breathe using our nose and our mouth, since you've closed your nose, you're supposed to open your mouth widely so that the patient can be able to do what? To breathe like this. The patient is not supposed to blow the nose often, because the often you blow your nose, the more you're going to remove the blood. And remember, the blood is important to supply oxygen and nutrients. So when you remove your blood so much, this may lead to shortage of blood, which is anemia, may cause anemia. Something else is use a towel or a clothing. For my case, this is what I've brought. And then make sure you pour some little water on it. This is for the purpose of, and first of all, pour warm water, because cold water may cause cold, and we don't want that patient again to be sick, to have a common cold. So use warm water, and then try to massage your nose. So massage your nose with a handkerchief that is wet, so that you can be able to relieve the nose from any pressure that may come along. Again, this is supposed to help you if you do not have a nasal spray, which is medicinal. It's prescribed by doctors for people who keep nose bleeding, so that it can relieve that nose bleeding process. So since this is wet, you can massage with it so that you can be able to remove any clotting of blood that can remain in the nose. Something else is, remember to put this patient at a room that has humidity in it. You can buy something that can release more humidity in the house, so that this person can reduce the nose bleeding process. There are some home remedies that you can give a patient who has nose bleeding problems. Make sure you give them fruits such as oranges, lemon juice, strawberries. This kind of fruit helps to increase. They are full of vitamins and minerals, and these are the kind of elements that you need in order to increase the blood level. Also, greens. Make sure that the patient is able to eat a lot of vegetables such as spinach, kienyeji. Yes, these are the kind of vegetables that are able to help this patient increase the level of blood in the body. If the process of first aid is not working well with the patient, then you're supposed to rush this person to a hospital. There are signs that are supposed to tell you whether this type of bleeding is serious. If the patient comes to an extent that they are fainting or fall any minute, leading to some other injuries, this shows that this person has got reduction of blood in the body, and so they need blood, rush this person to a hospital to prevent such occurrence. Because this person may faint when you're not around, and they may fall in the fire maybe, or even in water, or even they may hit themselves badly in their head, and this is not going to be okay with them. So rush this person to a hospital to keep the patient safe. So nose bleeding is not something that may lead you to being in tension. In short, don't tense when you see blood at the nose of a person. That person might be nose bleeding. It may take a shorter time, so at least perform this first aid to that person. Let that person be okay. If that person do not have something that can at least massage the nose, or can wipe away the nose, or cool the temperature, provide that person with that. You can also put the wet handkerchief or the wet towel on the forehead as the patient pinches the nose. This is for the purpose of reducing the temperature of the head, so that the cool the temperature, the better, because this person might be nose bleeding because of the dryness in the nose. So at least when you put a wet clothing on top of the head, this is going to release the humidity to a level that will be suitable for the patient. Some people tend to use the nasal spray many times and use the spray for the nose that prevents bleeding according to the doctor's prescriptions. Why? The more often you use this spray, the more used the body is going to adapt to it to an extent that you can resist the spray. And when it reaches to this point, the more often you're going to apply to the spray, the more often you're going to nosebleed. Do not overuse the drug. Okay, if it's not according to the doctor's prescription, do not use it. Don't offer someone else the spray. Maybe that person has another disease other than the one that the doctor prescribed for you. There are other medicines that you can give this person, like oxymetazoline. This helps the patient to add more oxygen. It gives more oxygen to the patient, and also it gives other products that the patient needs. Again, if a person is suffering from nose bleeding, it is not right for you to put this person in the oxygen gases to supply oxygen. No, maybe this person does not need a lot of oxygen. Maybe what they need is nutrients. So that's it for the episode. Hope you've enjoyed this episode. Hope you've liked the episode. Please give me the thumbs up and share widely so that we can be able to reach to 1,000 subscribers. Subscribe and always stay tuned. Turn on the notification bell so that you can be alerted every time I upload a video. I heart you and love you guys. Bye bye. Peace.